Well, good afternoon, everyone. I think we're going to get started. I would like to welcome you to our Geriatric Resource Ohio Work Group, GROW, ECHO, for July 22nd, 2020. The work for the ECHO is supported by a Geriatric Workforce Enhancement Program, GWEP, a cooperative agreement through HRSA. Our GWEP is housed at Northeast Ohio Medical University in Rootstown, Ohio. My name is Margie Sanders. I'm the project director of the grant, and today I will be acting as the facilitator for this ECHO. The title of today's ECHO is Improving Early Diagnosis and Post-Diagnosis Treatment of Dementia in Primary Care. Please keep in mind that the format for the Project ECHO events consists of an introductory didactic session followed by an interactive case presentation and discussion between frontline providers and our experts. Before we begin, I would like the GROW Hub team to introduce themselves. Denise?
Sorry about that. I've got a lot of things popping up on my computer screen.
Sorry.
I'm Denise Kropp, and I am the coordinator for the GROW ECHO.
Dr. Drost?
Dr. Drost, we couldn't hear you. I think you're on mute.
I muted my phone. Yes, this is Dr. Jen Drost. I'm a geriatrician with the Hub team.
Thank you. Brandy?
Hi, I'm Brandy Krasinowski. I'm social worker with the Hub team.
Sue Fosnight?
I'm Sue Fosnight. I am pharmacist with the Hub team.
And Sue Hazlett. Sue, we need you to unmute.
Hi, I'm Sue Hazlett. I'm a nurse with the Hub team.
All right, thank you. Amazing group to work with. I would like to introduce our presenters for today's ECHO, and they are Karen Elliott, who is the program director for the Greater Eastern Ohio chapter of the Alzheimer's Association, also on the GWEP, and a longtime friend. Also presenting with Karen will be Amy Boehm, who is the Health Systems Director for the Alzheimer's Association Region 10, which consists of Ohio, Michigan, and Virginia. So before we get started, I would just like to make some housekeeping comments. Please mute yourself during the presentation. To communicate with the group, please use the chat function and share all chats with the entire group. Please make sure your name shows on the screen as well as your face so that our ECHO team will become more familiar with each other. We're really growing community here, folks. And during the case presentation, we can unmute to participate in the discussion as you wish. And just so you are aware, today's session is being recorded, and be aware that the details of the cases have been changed to ensure patient privacy. At this point, I am going to turn this over to Karen to begin the didactic portion of the ECHO.
Great, thank you so much, Margie, for the beautiful introduction as well. I'm going to share my screen with you here, so bear with me for a minute. Okay, great. I think everyone can see the screen. So thank you and welcome. Thank you for allowing us to participate today. What we hope to achieve in the little bit of time that we have today is to really look at the mission and vision of the association and share with you resources that will help your patients and their families and community members. Also talk to you a little bit about what resources we have for you as healthcare professionals, and then discuss the work that we're doing in order to extend access to early detection and diagnosis, and then our support of health systems and healthcare providers in providing care after that point. So the mission of the Alzheimer's Association is really threefold. So we're looking to lead the way to end Alzheimer's and all other dementias in three ways. One is by accelerating global research, driving risk reduction and early detection, and then certainly maximizing quality care and support for all who are affected. And our vision is a world without Alzheimer's and all other dementias. And this piece here gives you an idea of what areas we serve. So we're the Greater East Ohio Area Chapter, and we serve the 17 counties you can see in white here. So we're looking at the top at Medina, Summit County, Portage, Trumbull, all the way down to Muskingum counties. And we have about 60,000 people we estimate with the disease in our service area, which is actually the largest prevalence of people with the disease within the 7 chapters that serve Ohio. I want to go through the resources for our families. I think one of the things that we hear most is that families will say, I wished I had been connected with you sooner, or I wish my physician or social worker would have connected me with the association earlier in our journey. So I really want to just take a minute and share with you the different programs and services that we have at the Alzheimer's Association. The first one is our 24/7 helpline. So that is every day of the year. It's never closed. There's an option for you to talk to a master's level clinician at any time to discuss your situation. Just reliable support and information whenever you need it. And we have the ability to provide that in 200 different languages and dialects. So if English is not your first language, it's still something that you can access. Our community education is just that, education programs in the community that range anywhere from brain risk, reducing your risk for the disease, brain health, all the way to dealing with difficult behaviors and enhancing communication strategies for persons with dementia diseases. We have a program we call Side by Side, which is our care consultation program. And what we know is that, this is not a disease to walk along alone. So our goal is to really provide this free ongoing support to families that are dealing with a loved one with some kind of dementia. If a person is early stage, they can also participate in the side-by-side care consultation. People really feel, and this disease is very isolating, so we want folks to know that they are not alone. So we offer nearly 30 support groups in our 17 county service area. We have a couple of specialty groups. We have a faith-based group, a men's caregiver support group, and one for the frontotemporal degeneration diseases. And the next slide, I'm going to tell you a little bit about those last two are online resources. So one is Trial Match, and this is a free matching service for clinical trials. I did just get an email last night for one that was assessing an internet assessment for assessing my coping strategies and my feelings of isolation during COVID-19. But it can be anything from a healthy volunteer like myself that can participate to someone with any kind of dementia disease and their caregivers. Alzheimer's Navigator is a program for someone who would like to kind of remain more anonymous, likes to do things over the computer, but walks you through a customized list of options. So you would walk through some questions. It would offer you a personalized action plan that may include one of the other programs and services we offer at the chapter. All's Connected is our message board, and that is a community where folks can get on there, maybe in lieu of a support group, ask some questions, read through what other people are doing to navigate this disease. And then our care team calendar is a unique resource that allows folks to really bring in the family group. So if you have a larger family or it's a challenge to communicate the needs for your person with memory loss, you can actually create your own community and set up appointments, reminders for appointments, put on their daily tasks that someone needs to do for your loved one, and members of that community can sign up for those tasks. So it really offers the opportunity to share caregiving across the family network or friends network. Our community resource finder is another way that someone who is just perusing the internet can find both services of the association and programs of the association, as well as AARP, who we partner with on that program, as well as just community resources from housing options, care at home, medical services, housing, legal services, etc. So they can access local resources through the Community Resource Finder as well. And then our e-learning workshops, same things, offers the education to these families just via our website and the presentations that are loaded on our website if they don't want to join us virtually or they don't want to join us in person when we get back to that time. They can certainly take advantage of the e-learning workshops. And the Greenfield Library is our virtual library that is housed in our main office in Chicago, and it's the nation's largest Alzheimer's library. So chapter staff, board members, the community, if you're looking for information, you need to, some research articles or just videos, books, you can search the Greenfield Virtual Library for any of those resources. And I think what I forgot to mention to you is all of our services are free, so there's no charge to the families. So if they have need of us for multiple side-by-side care consultations to get them through a situation they're in, they are more than welcome, and we're more than glad to do that. We have a lot of longevity with a lot of our families, and like I say, none of those services have any fee associated with those. So I want to turn it over to Amy in just a minute, but I want to just share with you how we can support your families. And if you have families that you're working with that you'd like us to reach out to, we do have a HIPAA compliant referral form located at the web address on your screen. So if you just plug in the information on the family that needs us, we will reach out to them within 48 hours. And we can also provide you with some detailed feedback if you so wish on what that conversation looked like and what programs and services that family chose to avail themselves to. So if you need us, that's definitely a great way to get a hold of us. But at the end of the presentation, you also have my contact information with my email address. If you prefer to use that method and call me and give me some idea of what's going on, we'd be glad to reach out to those families and see what we could do to help. So I'm going to turn it over to Amy right now to talk a little bit about our health systems initiative and what we're doing to extend our reach and access to those that are around us in Ohio that need some help, and to provide you with some resources for assisting those folks as well. Amy?
Thank you so much, Karen. And thank you so much for the invitation to allow us to present some of our information. I think this is a really great example of how as an organization, we have a great local touch through Karen and the work that she's doing. But we also, my work is throughout the region. So I'm working with Michigan, I'm working with Ohio and West Virginia to advance the health system initiative forward, as we have launched it last year with the organization, but have been really thinking about this work over the last couple of years. And I think historically, we have done a fantastic job embedding ourselves in the community and supporting physicians with the care consultation, the education, and the support groups. And right now with the Health System Initiative, we're really working on building up that and continuing that work, but then really looking at where we have some additional gaps to close when it comes to early detection and the care that's being delivered to those after the time of diagnosis. So with the Health System Initiative, we have staff like myself working all throughout the country with priority health systems that we've identified. Somewhere around the 300 to 325 health systems that we're working with the goal to help clinicians achieve improved health outcomes for those that are facing a dementia diagnosis, enhancing the clinical experience for those patients and their families through some of the resources that Karen referred to. We're also looking at reducing the burden that's on clinicians as well through the tools, the resources, the training that we have available as well, and then managing the cost of care effectively. We know that health systems are really looking at strategies to decrease hospitalization and emergency room visits. And so we're looking at ways that we can help assist in that area as well. The slide that we have up here is really talking about the value of a timely and accurate diagnosis. And we know that the quality of life can be significantly enhanced by patients receiving an early diagnosis, an accurate diagnosis in the disease process, care plans being developed out that help the patient, and not only the patient, but the caregiver as they journey through this disease. We're also looking at reducing the burden of comorbidities. We know patients are coming in with not only dementia or cognitive decline that they're facing, but other diseases that sometimes take priority. So how do we help balance the other comorbidities as well? And then all the way to, legal and financial developing strategies as well, and then the information on clinical trials. Next slide, please. So the Alzheimer's Association in 2019 released its facts and figures, and we had a special report in that facts and figures that really addressed Alzheimer's detection in the primary care setting. The link for that is at the bottom here, but what we were able to find out is that 94% of primary care providers consider it important to assess all patients 65 and older for cognitive impairment, but fewer than half say that it's standard protocol. In addition, 82% of seniors believe that it's important to have their memory checked, but only 1 in 7 are receiving regular cognitive assessments for memory and thinking issues. What we're finding is that these physicians have a prime opportunity during the Medicare annual wellness visit to really start that conversation and start the assessment process to look for cognitive decline. We also found that nearly all the primary care providers reported wanting more information and guidance when it comes to assessment tools, when to use these tools, when the tools indicate normal cognition, when is retesting appropriate, and how to disclose cognitive impairment to patients and caregivers. So we heard from these primary care physicians, and we were able to take some of that information then to develop out some of the tools and resources that we have available now. Next slide, please. The next slide talks a little bit about some of the tools and resources that we do have to assist clinicians. And you can see at the top, it's alz.org/professionals. And we have developed some turnkey tools for you. We have a cognitive assessment toolkit that has some algorithms built in on when and how to assess patients for cognitive decline, all the way down to care planning, and a really great care planning toolkit that details out the CPT code 99483 and provides tools and resources that help meet each of those essential element requirements under that CPT code. In addition to all of the tools and resources that we have, actually, you know what, next slide, Karen. In addition, we also have a really nice physician mobile app that you can download, those online tools that I just mentioned, and then our referral form. And I would say one of the biggest tools and resources that we have is your staff partner support. So the support that Karen can provide to you locally to help out with patients and caregivers as they're working through a diagnosis, as well as the tools and support I can provide to you in the way of influencing and providing technical assistance with practice changes that clinicians might want to implement within their practice. One of the resources that we want to share today is the Alzheimer's Association. We have developed our own Alzheimer's and Dementia Care Project Echo series, and we are about to launch our third cohort. But with the Project Echo series, and I know that you're all now familiar with Project Echo, we are focusing specifically on primary care practices and engaging them in this Project Echo series. Next slide, please. Some of the benefits that we're seeing in the participation with our Echo is, really that increased skill and expertise in dementia care. We're looking at improving the access to that timely and accurate diagnosis, really focusing in on the right care at the right time. We're retaining providers, reducing disparities, and allowing patients to stay local. And I think as Ohio has so many rural areas, throughout the state. I think that's a big key piece to a lot of the health systems and some of the things that they're looking for is being able to provide local care and allowing patients to stay local. And then, you know, really looking at how are we improving the patient experience. Next slide, please. The next slide is already out of date. I just received this morning an update here, but this is when we launched our first 2 Project Echo cohorts. At that time, we had 16 practices participating. We're just finishing up our 3rd cohort, and so we're up to 28 practices that have participated in our Echo series, spreading across 10 different states throughout the country. And like I said, we're ready to launch our next Echo series. And one of the things, especially through the last one that launched in March and is finishing up next month, of course, COVID played a big piece in the discussion. And we really tried to make it relevant to some of the struggles and challenges that clinicians were facing in the current COVID crisis. So we do try, although we do have a curriculum that is set, we do try to make it relevant to the times. And certainly, during this last cohort, we spent a lot of time talking about COVID. Next slide, please. Some of the key features is that we have care-based discussion where providers are providing a de-identified case for discussion and receive guidance and mentoring from a multidisciplinary team of experts around the country. We also spend time with our didactic presentation talking about a number of different topics that we'll show you in just a second. The biggest thing is that this is free, as you know, and CEs are provided as well. The next slide you'll see is some of our faculty, and we've actually added on to this, but you can see here that we have faculty members from around the country, Mayo Clinic, Indiana University, University of Florida. And the other thing is that we have a variety of specialties as well, providing, again, that mentoring and advice to the practices that are participating. Next slide, please. So the criteria for participation. So we ask that we have a dedicated provider. That might be a physician or a nurse practitioner that takes the lead in that practice and participating. And then they're also inviting others within the practice. So it is that multidisciplinary approach. So we're looking at medical assistants, we're looking at social workers, care managers that might also participate. Again, the goal of this is that we're driving practice change. And we know that all of those people play an important part in for that to happen. Of course, Wi-Fi access, webcam access is required. A commitment to participate in the majority of sessions. So we're asking that you participate in 80% of the sessions and provide 2 de-identified patient cases to discuss. Next slide, please. Our next cohort launches September 17th. Our sessions are every other Thursday from 1 to 2 p.m. And you can see here the topics that will be discussed. And again, we're asking that there's some dedicated staff that participate in all of the sessions, but there might be sessions here that other staff within the practice or partnering practices might have an interest in participating. And so other people can flow in and out as appropriate as well. But you can see we start from the diseases causing dementia. We talk about communication with patients and caregivers, all the way down to advanced care planning and coordination of care and transition of care. So we cover a wide variety of topics that are relevant to how primary care physicians can make some changes within their practice, again, to ensure early diagnosis is happening and quality care is being delivered. The other piece to this is that I, as your staff partner, then work with you throughout this to gather your feedback, to hear the interventions that you want to start implementing. And then as we wrap this up, the series wraps up, we spend some time talking about improvement projects that can be made and how I can be of service in those projects. You know, we've covered a lot of information here in a very, very short amount of time. And I think, you know, Karen had mentioned it, but I will also mention it. If you would like some one-on-one time with us, we're certainly happy to do that in diving a little bit deeper into this. If you're interested in participating in our Project Echo series or have more questions about that, let me know. I do have the application. We do accept about 12 in our cohort, 12 practices. So if you are interested, please let me know as soon as possible so we can have that application completed. The other thing I will say, and it's not on the slides, but I would be remiss if I did not mention that the Alzheimer's Association International Conference, we call it the AAIC, is taking place next week. So it's July 27th through the 31st. I'm going to put the information in the chat so you can have that, the website for registration. But this is the largest and most influential international meeting that takes place. This year it was supposed to be in the Netherlands. However, because of COVID, it is now virtual, which also means that it is open for everyone to participate. There will be many live sessions and there will be on-demand sessions as well. So if you have an interest in topics such as the basic science around Alzheimer's and dementia, biomarkers, drug development, all the way to public health, psychosocial factors, and dementia care practice, please look into this and register. Again, it's free, it's next week, and it'll be really great. And I will put the information in the chat, but like I said, I would be remiss if I did not mention that happening. So thank you so much, and we'll take any questions that you might have.
Yes, we did have a question from Dr. Whitehouse. Dr. Whitehouse, would you just get on and ask that question of our presenters?
Hi, everybody. Good to see you all now. Let me look at the camera instead of at the screen. So I actually had two related questions. Thanks for this presentation. One, in our latest thoughts about diagnosis, I note that the NAPA panel is having a new committee on diagnostic labeling to try to bring some coherence to it. But the question I had was, do you as an organization in your early diagnosis efforts promote the label subjective cognitive decline? It's kind of the pre-MCI before you even have test result problems. And the next question that relates to that, of course, is related to that, is in therapies. What are your expectations about aducanumab, which I believe the FDA now has about 45 days left to issue some kind of thinking about its likelihood for approval?
Well, I will start with the drug first, and I anticipate, I don't have an answer to that, but I anticipate this will be a hot topic on that AAIC conference taking place, especially as, you know, we are talking about it moving very quickly. I think we're excited about any, you know, advancements in drug development, so we're certainly keeping an eye on what's happening there. But like I said, I bet there will be a lot more conversation taking place with that. The other piece is
I'm going, so thank you. Yeah, I agree.
Yep. Great. The other piece on that you had mentioned about subjective cognitive decline, I think as we know more about dementia, Alzheimer's, mild cognitive impairment, we are looking at ways that we can start introducing interventions very early on. So I think anytime we have an opportunity to diagnose early, or at least be able to look at some factors that just don't look right or might be questionable, I think is an opportunity for us to flag some patients for specific interventions around nutrition, physical activity, but not only that, making sure that they're being retested on a regular basis. So making sure that we're flagging them for that as well. So I think this is a great area of opportunity that our organization's looking at as well, because we know if we're able to diagnose early, at the earliest stage, we have an opportunity to introduce some interventions that might not necessarily stop anything, but slow progression.
Thank you.
Thank you. Any other questions for our presenters?
Hi, this is Pat Vermeersch. I'm just wondering if you can send us, a lot of these links are embedded in the slides, but I can't get at them. In addition to the information on registering as a practice for the upcoming series. Can that be emailed out to all of us in an email or something that I can hold on to?
The slides will be sent out to everybody in a follow-up email.
Okay,
And,
great.
Denise, I can also get you the application as well and more information about the upcoming Project Echo series. So if you're sending out the slides and if you wouldn't mind sending that out as well, that would be great.
I would be happy to.
Thank you.